All right. I think we got that set up.
All right, perfect. It's recording on my end as well. So I was thinking we can go back and forth between answering the questions versus wait until one is finished completely.
Yeah.
Okay,
That's
sounds
good.
good. Would
I
you
think we
like to
should probably
start?
start with the have you had the previous experience with Zoom or video conferencing? Because I have not. I've done it like once with a doctor's appointment that I had, and I was like, this is really awkward, but I don't know how to do it.
Right. Like it's a good idea in theory. However, like it's just kind of weird the way you set it up. But
Right.
out of the different like platforms that I've used for like the virtual meeting, like WebEx, I know most hospitals use WebEx, but Zoom is a little bit better. And like I don't have that much experience with it. It was just like when my nursing school went towards virtual during like March when everything started.
Right.
That's probably about as much as I got with the experience with it, and it's
Yeah.
okay.
Yeah. I wasn't in school when when it started, so of course I wasn't in class. I didn't
Hmm.
have to worry about it. So when I started school in August, I was like, okay, well, this class I don't have to do anything like that, but this one started, and I was like, okay, here we go.
Right. So, yeah, I was briefly just introduced to it because of all of that, but it looks like we're all getting ready to become familiar with it.
Right, right. It's going to be much needed and very useful, I think. I mean, I like the concept of it. I think it's pretty cool to be able to chat like this one-on-one or even in a group of more people if that's possible. But um, otherwise, I like it. I mean, it's just difficult to try to set up when you've never done it before.
Exactly, with no guidance, essentially.
Right, right. All right. So, what motivated you to return to school?
Um, so I know that okay, well, you might not know, but I recently just graduated in May, and
Okay,
boom, here we
congratulations.
are thank you, starting school back in August. So most people probably think I'm crazy. However, like so far with my job, I don't know. So far, I feel like I feel like I'm doing more tasking, and that might just be because I'm a new nurse and I'm trying to get my flow of things. But
Right.
right now, I just feel like my work is more of tasks, like check this off, check, 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 and I don't really feel as if I'm getting a chance to actually make a difference, so to speak. Like I feel like
Right.
I'm just more of reacting to certain situations versus being proactive and trying to prevent it. So don't get me wrong, like I know
Right.
in nursing school they teach you how prevention tips and all of that, but realistically at the bedside it's a little bit harder. And it is,
Absolutely.
yeah, and it could just be because like I said, I'm new and I'm just trying to get things done. But yeah, when I started and I jumped in and I seen exactly how things was going, I was just like, yeah, I'm definitely gonna need some more education. Um,
Right.
and also to be realistic, most jobs, when you sign on, they want you to get your bachelor's within in so many amount of years. Most of the hospitals I've seen so far is like 5 years,
Right. Yeah.
and it's better job security as well because each hospital has to have so many nurses with a bachelor's degree versus their ADN.
Right. That's pretty much where I was. I've been a nurse for 2 years now.
Okay.
And at first, right, like kind of like before I started, they got away with the RNs at my hospital had to have their BSN within 5 years, and they were like, no, if because I guess we had probably enough. You could
Mm-hmm.
never have enough nurses, but they didn't like need a whole lot of bachelors. So they got away with that, and I was like, you know what, I might as well still get it because one, it looks good on a resume,
Mm-hmm.
and it makes you more wanted when you do go to the job interviews. So if I'm sitting next to an RN who doesn't have that and a BSN with me, I might get the job before that one does, depending on
Exactly.
experience, depending on, what they have. And it just looks good. And more education is never a bad thing. I just don't see myself going into the management role. Um, I like being at the bedside. I don't want to lose my skills. So, and I don't really care about the money side of the hospital or this. I care about the staffing side. I want to make sure we have safe staffing ratios and, stuff like that. But I don't want to be in the admin role to facilitate that kind of stuff. I like being at the bedside.
Mm-hmm.
So that's where my idea behind it is, and of course, get more knowledge out of it. And if I do change my mind later on, I have it, I can.
Right. And like, so essentially you just answered that question, like, what are your plans after earning your BSN? And
Right.
I think that's really ironic because I feel the same way. Like, I said that I wanted to stay at the bedside because I
Mhm.
feel like, first of all, I literally so far I love being at the bedside. Like
Yeah.
interacting with the patients is the highlight, and I'm one of those that I can get sucked into the room for like 30 minutes because me and my
Mhm.
patients just having such a good time. Like
Yes.
I really connect with them and I love it. And I feel like people when they go back and get their bachelor's, like they branch off into other things, which is fine. However, like we still need nurses who got those skills on the higher education to, actually apply it at the bedside. And so that way
Mhm.
you can make a difference because, me if I was a bachelor's level nurse and I've learned all of these like evidence-based practice things and I'm trying to implement it to the nurses who may just be an ADN nurse, it sounds good, but realistically, I feel like I need to be the one to actually roll it out and practice it at the bedside before I
Right.
can say, hey, this is what you should be doing. Because realistically, no one wants to listen to someone who actually hasn't tested out this theory themselves.
Exactly. And that's, you basically pretty much answered that. What to expect to learn in the program is we're going to learn more about that evidence-based practice, and
Mm-hmm.
nursing as a whole in the community, I think is where I'm wanting to look at more, just so that I know, going out to the community, okay, what do I do as a nurse? What are my resources? What do I have available for me? And to be able to put all that together makes it kind of a whole, basically. We're learning every day that we're at work.
Mm-hmm.
And like you said, yeah, you're a new nurse, but you're going to learn every day. You're not done. I still learn every day. And it's just like, I'm like, oh, why didn't I know that before? You haven't done it yet, right? So the more you get introduced to things, the more your knowledge is going to expand, and the more you're going to feel confident about it. Me as an ER nurse, I get faced with challenges every day because there's things that I haven't seen, and I'm like, oh, what is that? Or, what am I going to do for this patient? And to
Right.
be proactive, yeah, I might know, like ER nurses, we have our doctors on the floor with us. So I know most of our doctors, what their protocols are, how they want to go into patient care for that specific patient and what they're doing. And you'll get that too. Um, it's just one of those things that comes with time, comes with experience.
Wow. Yeah. As an ER nurse, thank you for your service because
Oh, no problem.
I can't.
Well,
I,
I'll put it this way. I've been in the ER for October will be 10 years.
wow.
I was a patient care associate beforehand, so I did a lot of basically what CNAs do.
Mm-hmm.
I did that beforehand and I loved it. I was like, oh, I want to be a nurse so bad. So I went to nursing school. Um, and I was like, okay, all I want to do is the ER because that's what I know, that's what I love. But now, after being a nurse in there for 2 years, I'm kind of like, okay, well, I know the ER, I know the flow, I know how it is, but I don't know anything else but that. Of course, we're an emergency trauma center, so I deal with traumas and heart attacks and strokes and all that, and I know what to do for those, but I don't know a lot about labor and delivery. And that's why when we do get those laboring mothers coming in, I'm like, oh, let me go into that. Because one, who doesn't love a new baby being born? It's probably disgusting, but it's fantastic. It's like amazing.
Right.
But I think that's where I want to go next. And of course, having my bachelor's when I apply for that job is gonna look a lot better for me. So that's where I'm headed next, is a different unit to gain more experience, to learn new skills, and hopefully, move on to the next after that.
Right. That sounds good. And like with me, I'm on a med surge floor essentially. It's more surgical, but honestly it's a mix of everything.
Right.
And that's what I wanted because with me being new, I mean I was a medical assistant first at an OBGYN.
Oh, yeah.
So I know all about women's care. And then I was a CNA on a palliative care unit, which is completely opposite from the type
Opposite,
of nursing
right,
I'm interested in. So
right,
I felt like, this floor was a good opportunity for me to be able to see a lot of different things because, I'm really for health promotion. Like
mhm,
I want to be proactive versus reactive. Like I don't feel right just sending people home with, oh, well, you have diabetes, here's your insulin, take this and you'll always have diabetes. Like, why can't
right,
we, break it down to the patients where they understand better that, hey, if you just change our eating habits and, try to start walking every day or, 10, 20 minutes, something like that. I feel like healthcare is now just a patch job versus like actually preventing it. And like,
right,
really, I really hope to gain like methods so I can actually like, institute this in the facility I'm working at, just to kind of, it's like things we already know, basics, but I think like getting my bachelor's will give me the skills and like the education I need to actually start implementing some of these policies.
right. I completely agree with that 100%. That's pretty much, where it's at is, I think it's more, like I was saying earlier, more health in the community, like health in general in our community, whether it's outside resources for these patients. Because for the ER, either we send them upstairs to the, med surg floors or wherever they got to go, or we send them home. And what are we sending them home with is what they need, because otherwise they're going to fall into the same habits. They're going to fall into the same, hole that got them in the situation that they're in. So what can we do in the community to kind of help that? And of course, you talk about eating habits and diet changes, but really, okay, do they know where to go to get those resources? So
Right.
I think getting our BSN is going to be overall a great thing in all aspects of our career. And it opens doors. I mean, we can go pretty much anywhere as a nurse. It's just the level of experience you have and your education. I mean, that's what's going to get us up and where we need to be.
Exactly. So, yeah, look, I'm very excited because we are like literally on the same page, and it's just crazy that out of all the people who were setting up their meetings or whatever, that we ended up having to meet with each other, and then like our views are so similar.
Right, right. I was like, I thought it was gonna be hard because I was like, dang, some of these people already have, partners, and I'm like, I don't know where to go with. I don't know anybody, so what am I gonna do? Thank you
Right.
for reaching out to me. I appreciate it. And I look forward to definitely, hopefully we're gonna be in some more classes together.
Right.
So
And now I don't feel as lonely. I know I have one person that I know.
exactly. All right. Well, I think we pretty much answered everything. Did you have anything else you wanted to add?
No. What I'll do is I'll stop the recording,
Okay.
and I think for you, I think you have to stop it on your end too. It's that upper left.